Good morning. In March of last year, we knew very little about what we were simply calling the coronavirus. We knew it was deadly, that it was spreading fast, and that we had to act quickly to keep everyone safe. We thought such a response would be one that everyone would support. After all, what is more important than saving lives? But as public health protocols were put into place to keep our families, friends, and neighbors from getting sick and dying, a strong pushback began. Misinformation spread. Public health officials were threatened, and selfishness and ignorance were on full display. A pandemic that has taken the lives of more than 700,000 people in this country became as much of a political issue as a public health issue. But as a medical doctor, I believe in science. I believe in those in our research labs, our emergency rooms, our clinics, our ICUs. I believe that the majority of America knows that sacrifices must be made to get through challenging times, like a global pandemic. I've made decisions at the advice of our local medical experts working in some of the best hospitals in the country. And I've made decisions based on what public health officials here and at the national level have recommended. And I've made decisions that have saved lives. And that's why I support a mask requirement. Masks have helped slow the spread of the virus, and masks continue to be necessary until more people get vaccinated. Many of our school-aged children are not yet eligible for the vaccine, so we must protect them and give them every opportunity to remain in the classroom where learning is ideal. As I said about the court's ruling last week, St. Louis County mask order stays in force, and that ensures that we continue seeing our case numbers go in the right direction. There's lots of talk around enforcement. Enforcement has never been our focus. Our focus has always been on protecting lives and livelihoods. And that's why a mask order was adopted in July, and that's why one remains in effect now. For those of you watching the numbers closely, our vaccine rate is going up gradually, and the number of average daily COVID-19 cases is going down. This is progress, but it's not the time to let up on doing the right thing. The vaccination rate is slow. In St. Louis County, about 53% of residents are fully vaccinated. The bulk of the COVID-19 vaccine doses currently being administered to St. Louis County residents are boosters. Of the 2,705 average daily doses administered, 1,780 are booster doses, 446 are second doses, and 479 are first doses. Until our young children can get the vaccine, we cannot risk putting them in danger by relaxing a simple requirement: wear a mask when in indoor public spaces. For those who have not yet been vaccinated, please talk to your doctor or to a family member who has received the vaccine. Find out more about its effectiveness and how it can not only save your life, but those you live with, work with, attend social gatherings with, those who mean the most to you. Talk with your clergy member. They want to protect their flock, and they know that the vaccine is the best way to get everyone safely back together in one space. Vaccines are widely available, effective, and free, and there are many opportunities throughout the county to receive one today. Go to revivestl.com and click on Get Your Vaccine. There you can type in your zip code and find a vaccine opportunity close to you. Every day we are closer to where we need to be to get past this pandemic, but we must remain vigilant. With cooler weather, that means more people indoors, more opportunity for spread. And we don't know what form the virus will take next. The Delta variant drove our numbers up again after a steady decline. What we do know is that masks work, a simple, responsible gesture showing respect and responsibility. And with vaccines, we have overcome some of our biggest health challenges, including smallpox and polio. History shows that vaccines work and that they save lives. Please get your COVID-19 vaccine today. And I'd be happy to take any questions.
Page, we have one from Public Radio about ARPA funds. Can you elaborate on what your 2022 budget will be with American Rescue Plan funding? How much money will go to plug budgetary holes, and why do you think that's a prudent use of the funds?
So the question is about ARPA funding. Federal stimulus funds, and our recommendation for the County Council. The County Council is currently in budget hearings, and we'll consider and approve the 2020 budget over the next couple of months. My recommendation was to use $85 million of the $193 million ARPA funds to plug budget holes and replace lost revenue due to the pandemic. That will allow us to continue funding our basic services in St. Louis County, primarily public health and public safety, and will allow us to avoid the difficult conversations about budget cuts because of lost revenue or property tax increases. And I think that's the right path forward. Any other questions? Okay, thank you.